Breast lump in young females, causes, diagnosis, and fibroadenoma treatment explained.
Hello everyone, welcome to Surgery Explained to You. Finding a breast lump can be extremely frightening, especially for a young woman. Many patients immediately fear cancer.
But the good news is that in younger females, most breast lumps are actually benign, meaning non-cancerous.
One of the most common benign breast lumps is called a fibroadenoma.
In today's video, we will discuss the common causes of breast lumps in young females, important warning signs, what exactly a fibroadenoma is, how doctors diagnose it, treatment options, and the long-term prognosis.
Let's begin. A breast lump does not always mean cancer. There are many possible causes. The first and most common is fibroadenoma.
This is the most common benign breast tumor in young women, especially between 15 and 35 years of age.
It is usually smooth, firm, mobile, and painless.
Many doctors call it a breast mouse because it moves freely under the skin.
Another common condition is fibrocystic change. Some women develop lumpy or painful breasts due to hormonal changes during the menstrual cycle. Symptoms may worsen before periods. Breast cysts are another possibility.
A cyst is a fluid-filled swelling inside the breast.
It may feel soft or tense and can sometimes become painful. Breast abscess is an infection in the breast, commonly seen during breastfeeding. Patients may develop pain, redness, swelling, and fever. Another condition is a phyllodes tumor. This is less common but can grow rapidly and become very large. Some are benign while others may behave aggressively. Lipoma is a benign fatty lump.
It is usually soft and painless.
And finally, breast cancer. Although breast cancer is less common in young women, it must never be ignored.
Warning signs include a hard irregular lump, skin dimpling, nipple retraction, bloody nipple discharge, enlarged lymph nodes, or a strong family history of breast cancer.
Any persistent breast lump should always be evaluated by a doctor. Now let's talk specifically about fibroadenoma. A fibroadenoma is a benign tumor made of fibrous tissue and glandular breast tissue.
It is not cancer.
It commonly occurs in young females due to hormonal influence, especially estrogen. Most fibroadenomas are round or oval, well-defined, rubbery, mobile, and painless.
Some remain stable in size, while others may slowly increase.
Doctors usually diagnose fibroadenoma using something called the triple assessment. The first step is clinical examination.
The surgeon examines the size, shape, mobility, tenderness, skin changes, and lymph nodes.
A fibroadenoma typically feels smooth and mobile. The second step is imaging.
In young females, ultrasound is usually the first investigation.
Ultrasound often shows a well-defined oval solid lesion.
In older females, mammography may also be performed.
The third step is tissue diagnosis.
Doctors may perform FNAC, which stands for fine needle aspiration cytology, or a core needle biopsy.
Core biopsy usually provides a larger tissue sample and is more accurate. A confirmed fibroadenoma shows benign tissue without cancer cells. Now let's discuss treatment options. Treatment depends on the patient's age, the size of the lump, symptoms, growth pattern, and patient anxiety. The first option is observation.
Small fibroadenomas that are typical in appearance, biopsy proven, and not growing may simply be observed with regular follow-up and repeat ultrasound.
Some fibroadenomas even shrink spontaneously over time. The second option is surgical excision.
Surgery may be recommended if the lump is large, increasing in size, painful, causing cosmetic concern, or if the diagnosis is uncertain. The operation is usually minor and is called excision biopsy or lumpectomy.
The lump is removed through a small incision. The third option includes minimally invasive procedures. In some centers, selected fibroadenomas can be treated using vacuum-assisted excision or cryoablation. These are less invasive alternatives. A very common question is whether fibroadenoma can turn into cancer. The risk of cancer developing inside a simple fibroadenoma is extremely low. Most fibroadenomas remain benign throughout life. However, complex fibroadenomas, strong family history, or suspicious imaging findings may require closer follow-up. The prognosis of fibroadenoma is excellent.
Most patients live completely normal lives, do not develop cancer, and recover fully after treatment.
Recurrence can occur in some women, especially younger patients, but this is usually still benign.
The most important thing is proper medical evaluation of every persistent breast lump.
So in summary, not every breast lump is cancer. Fibroadenoma is one of the most common benign breast lumps in young women. Diagnosis is usually made through clinical examination, ultrasound, and biopsy.
Many cases only need observation, and the long-term prognosis is excellent. If you found this video helpful, please like, share, and subscribe to Surgery Explained to You for more easy-to-understand surgical topics.
Thank you for watching.